Hey there, and welcome back to our channel. In today's video, we're going to talk about a common condition that affects many people who menstruate, dysmenorrhea, also known as menstrual cramps. Menstrual cramps can be a real pain, both literally and figuratively. While some people experience mild discomfort, others may experience severe pain that interferes with daily activities. In this video, we'll discuss the causes of dysmenorrhea, the different types, and how to manage menstrual cramps. We'll also talk about when to seek medical attention and how to improve your quality of life during your menstrual cycle. So, whether you're someone who experiences mild cramps or someone who struggles with severe pain, this video is for you. So, grab a cup of tea, get comfortable, and let's dive into everything you need to know about dysmenorrhea. Causes of menstrual cramps. Menstrual cramps are caused by the contraction of the uterus during menstruation. The uterus produces a hormone-like substance called prostaglandins, which causes the uterus to contract and can cause pain and cramping. The level of prostaglandins varies from person to person, which is why some women may experience more severe menstrual cramps than others. Other factors that can contribute to menstrual cramps include endometriosis, uterine fibroids, and pelvic inflammatory disease. Symptoms of menstrual cramps. Menstrual cramps can vary in severity and can be felt in the lower abdomen, back, and thighs. Other symptoms can include nausea, vomiting, diarrhea, fatigue, and headaches. Symptoms typically occur before and during menstruation and can last for a few days. It can be difficult to determine if the pain of menstrual cramps is normal, as the level of pain can vary from person to person. However, here are some general guidelines that can help you determine if your menstrual cramps are normal. Mild to moderate pain. If you experience mild to moderate pain during your menstrual cycle that can be relieved with over-the-counter pain relievers or home remedies like applying heat to the lower abdomen, then your menstrual cramps are likely normal. Pain duration. Normal menstrual cramps typically last for 1 to 3 days during your menstrual cycle. If your pain lasts longer than this or occurs at other times in your cycle, it may be a sign of an underlying medical condition and you should consult with a healthcare provider. Pain location. Normal menstrual cramps are typically felt in the lower abdomen, back, and thighs. If you experience pain in other areas or if the pain is severe enough to interfere with your daily activities, it may be a sign of an underlying medical condition and you should consult with a healthcare provider. Other symptoms. Normal menstrual cramps may be accompanied by other symptoms such as nausea, vomiting, diarrhea, fatigue, and headaches. However, if you experience other symptoms such as heavy bleeding, fever, or unusual vaginal discharge, it may be a sign of an underlying medical condition and you should consult with a healthcare provider. If you are unsure if your menstrual cramps are normal, it is always best to consult with a healthcare provider. They can help determine if your pain is normal or if there is an underlying medical condition that needs to be addressed. There are several ways to relieve mild menstrual cramps. Here are some methods that may help. Over-the-counter pain relievers. Nonsteroidal anti-inflammatory drugs (NSAIDs) such as ibuprofen and naproxen can help relieve menstrual cramps. These medications work by reducing the levels of prostaglandins, which cause the uterus to contract and can cause pain and cramping. Heat therapy. Applying heat to the lower abdomen can help relax the muscles and alleviate menstrual cramps. You can use a heating pad, a hot water bottle, or take a warm bath to help relieve pain and discomfort. Exercise. Regular exercise can help reduce menstrual cramps by improving blood circulation and releasing endorphins, which are natural pain relievers. Try low-impact exercises such as walking, yoga, or swimming. Relaxation techniques. Stress can worsen menstrual cramps, so practicing relaxation techniques such as deep breathing, meditation, or yoga can help reduce stress and alleviate pain. Dietary changes. Eating a healthy, balanced diet that is rich in fruits, vegetables, and whole grains can help reduce menstrual cramps. Avoiding caffeine, alcohol, and salty or fatty foods may also help alleviate symptoms. It's important to note that if you experience severe or persistent menstrual cramps, or if your cramps are accompanied by other symptoms such as heavy bleeding or fever, you should consult with a healthcare provider. They can help determine the underlying cause of your pain and recommend appropriate treatment. There are several alternative therapies that may help with menstrual cramping. While these therapies may not work for everyone, they may be worth trying to see if they provide relief. Here are some alternative therapies that may help with menstrual cramping. Acupuncture. This traditional Chinese medicine technique involves inserting thin needles into specific points on the body to help reduce pain and inflammation. Some studies suggest that acupuncture may help relieve menstrual cramps. Herbal remedies. Certain herbs such as ginger, turmeric, and chamomile have anti-inflammatory properties and may help reduce menstrual cramps. You can try drinking herbal teas or taking supplements that contain these herbs. Aromatherapy. Essential oils such as lavender, peppermint, and clary sage may help reduce menstrual cramps. You can apply the oils topically or diffuse them in a room to help alleviate pain and discomfort. Massage therapy. Massaging the lower abdomen, back, and thighs can help relax the muscles and alleviate menstrual cramps. You can try self-massage or see a professional massage therapist. Chiropractic care. Some studies suggest that chiropractic adjustments may help relieve menstrual cramps by improving spinal alignment and reducing inflammation. It's important to note that alternative therapies should be used with caution and under the guidance of a qualified practitioner. If you have any underlying medical conditions or take any medications, you should consult with a healthcare provider before trying any alternative therapies. You should contact your healthcare provider about menstrual cramps if you experience any of the following. Severe pain. If you experience severe menstrual cramps that are not relieved by over-the-counter pain relievers or home remedies, you should contact your healthcare provider. Severe pain can be a sign of an underlying medical condition such as endometriosis, adenomyosis, or pelvic inflammatory disease. Long-lasting pain. If your menstrual cramps last longer than usual or occur at other times in your menstrual cycle, you should contact your healthcare provider. Long-lasting pain can be a sign of an underlying medical condition. Abnormal bleeding. If you experience heavy bleeding, clotting, or bleeding between periods, you should contact your healthcare provider. Abnormal bleeding can be a sign of an underlying medical condition such as fibroids, polyps, or a hormonal imbalance. Other symptoms. If your menstrual cramps are accompanied by other symptoms such as fever, nausea, vomiting, diarrhea, or unusual vaginal discharge, you should contact your healthcare provider. These symptoms can be a sign of an underlying medical condition that needs to be addressed. Difficulty managing symptoms. If you are having difficulty managing your menstrual cramps with over-the-counter pain relievers or home remedies, you should contact your healthcare provider. They can help determine the underlying cause of your pain and recommend appropriate treatment. It's important to listen to your body and seek medical attention if you have any concerns about your menstrual cramps. Your healthcare provider can help determine the underlying cause of your pain and recommend appropriate treatment to alleviate symptoms and improve your quality of life. In conclusion, dysmenorrhea, or menstrual cramps, is a common condition that affects many people who menstruate. The pain associated with dysmenorrhea is caused by the release of prostaglandins, hormone-like substances that cause the uterus to contract. There are two types of dysmenorrhea, primary and secondary, with the former being the most common and not caused by an underlying medical condition. Managing menstrual cramps can be done through various methods, including over-the-counter pain relievers, heat therapy, exercise, relaxation techniques, and dietary changes. However, it's essential to seek medical attention if the pain is severe or accompanied by other symptoms. By understanding dysmenorrhea and its management, you can improve your quality of life during your menstrual cycle. Thank you for watching this video, and don't forget to subscribe to our channel for more health-related content.